This is Abia COVID-19 update. Abia COVID-19 update.
Well, there is a new normal, and certainly life goes on. But some Abians are throwing caution to the wind, flouting the COVID-19 guidelines, such as avoiding crowded places, wearing face masks, and maintaining social distancing. Truly, life goes on, but with different rules of engagement. With the gradual reopening of places of worship coupled with the lifting of the ban on social gatherings, the impending spike in the number of infections is better imagined. New scientific revelations are emerging, and several epidemiologists that we've had on this program have revealed that it is not yet over. We've not even reached the peak, talk less of flattening the curve. As restrictions are lifted, many researchers worry that the risk of catching COVID-19 will go up in crowded indoor. It is a new virus, and they argue that converging lines of evidence indicates that coronavirus responsible for COVID-19 pandemic can pass from person to person in tiny droplets called aerosols that waft through the air and accumulate over time. And after months of debate about whether people can transmit the virus through exhaled air, there is a growing concern among scientists about this transmission route. And after scientists highlighted the risk, the World Health Organization has confirmed that coronavirus can spread through tiny droplets floating in the air in enclosed spaces. We also talked about that last week. Movement restrictions may have gone, but COVID-19 is still ravaging the world. It can only be defeated through the collaborative effort of all Nigerians, including Abians. The hard truth is that there is still no single magic bullet to subdue this raging health vampire. Now, scientists are saying that additional airborne interventions are needed for further reduction of infection risk, and nature advises that adequate ventilation can stop coronavirus from accumulating and potentially reduce airborne transmission. It's another week. It is Abia State COVID-19 update, the first edition for the new week. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19, as well as Abia State Governor Dr. Okezie Ikpeazu's efforts in ensuring that the state is safe from the virus. This program is running simultaneously every weekday, Mondays through Fridays, on several radio stations: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. And of course, the global number of deaths stands at 608,987 as at 8 a.m. today. That's the number of persons that have died globally due to coronavirus complications. Meanwhile, the total number of infections worldwide stands at 14,647,584. Also, the number of recovered cases is at 8,737,852. For the second day in a row, the World Health Organization reported a record spike in global COVID-19 cases, with over 250,000 new cases in the last 24 hours. The biggest increases reported were from the United States, Brazil, India, and South Africa. And of course, yesterday, Sunday, marked the 41st straight day coronavirus infections in the United States trended upward. 6 months after the pandemic first reached America, over 3.7 million cases have been detected, and at least over 130,000 people have died. And scientists have confirmed for the first time that the novel coronavirus behind the COVID-19 pandemic cannot be transmitted to people by mosquitoes. I repeat, scientists have confirmed for the first time that the novel coronavirus behind the COVID-19 pandemic cannot be transmitted to people by mosquitoes, a finding that adds evidence to WHO's claim that the disease is not mosquito-borne. Now let's bring it back home in Nigeria. The total number of coronavirus cases in Nigeria is headed towards the 37,000 mark, as Nigeria recorded 556 new cases of COVID-19 yesterday, unlike recent days. Edo State recorded the highest number of new cases, closely followed by Lagos. 11 deaths were recorded, bringing the total number of fatalities from the virus to 789. There has been an increase in infections since Nigeria eased its lockdown in early May. If you follow the trend, you will understand that the country has recorded a daily average of around 500 new cases over the past 1 week. The new cases were reported across 17 states and the Federal Capital Territory. Edo State recorded the highest amount of cases with 104 infections yesterday. Lagos followed, had the second highest amount of cases with 104 infections, 97 rather. Edo had 104, Lagos had 97, and the Federal Capital Territory had 70 new infections. Others are Benue State with 66, Oyo State with 61, Kaduna State with 38, Plateau State with 26, Osun State with 19, and Akwa Ibom State with 14, and to went on and on. And the records show that 15,105 persons have been discharged, with 789 deaths recorded so far. But as it stands now, 212,201 samples have been tested so far. Now let's quickly go straight to the discussion for the day. We have the Abia State Secretary to the state government. Of course, he's also the chairman of the Interministerial Committee on the Control of COVID-19. That's the task force set up by the governor. The chairman is joining us this morning, Barrister Chris Ezem. Glad to have you join us on Abia State COVID-19 update, Barrister.
Good morning.
Good morning to you. We understand that there is an inauguration that will take place tomorrow for aggressive case search in all the local government, all the 17 local government areas in Abia State. Can you take us through that, Barrister?
Not an inauguration, it's a flag off.
Okay, a flag off. Okay.
We are flagging off aggressive community testing. And we are flagging off that this morning, not tomorrow. This morning, we are flagging off that in the next few minutes at Umaya South local government to begin community testing throughout the 17 local governments. And what we want to do by that is to ensure that we'll start doing aggressive testing, test everybody as much as possible within all the local governments. Since our lab is working here, our samples can be processed within the state here. We don't need to go far off again. So we're encouraging everybody to come out and submit yourself for testing. And then we'll let you know that testing positive to coronavirus is not death sentence.
Okay.
If you test positive, you'll be nursed back to good health. Our doctors are there, our medical protocol teams are there. And even if you test negative, it's not a license to throw caution to the wind. You still need to stay safe. You still need to observe all protocol, because you can go out there and still contact it if you expose yourself. So this is the message.
It means we will have designated points across the 17 local government areas in Abia State.
The local government headquarters are the points. The health authorities are there. They've been trained to collect the samples. They collect the samples, they move it to the lab, and then it will be processed.
Okay, great. Now, the team is made up. Can you run us through what the team is like, what they are made up of, the health officials?
The health officials from all the local government health authorities have been trained by our medical protocol team. Their responsibility is simple, just to take the sample from each person. When they take the sample, that is where their job stops. The samples collected will all be taken to the lab, where it will be processed and the results will be released.
Interesting. What is expected of Abians if they are going to the local government headquarters?
What is expected of them is
Yes.
just to voluntarily bring themselves to the government headquarters for sample collection. And like I said, there's no fear, don't exercise any fear about it. That you test positive is not a death sentence, and that you test negative is not equally a license to throw caution to the wind. And we expect in the days to come in view of the aggressive testing, community testing we are doing now, our numbers may go up, but it's nothing to worry about. That is the effect of engaging in community testing.
Okay, Barrister.
And why we are doing this?
Okay.
Why we are doing this is to cut and break the chain of transmission. To break the chain of transmission and to get the curve.
Okay, one will be asking, it looks like we should be scared now that the government is going about a case search in all the 17 local government areas of Abia State. The big question for a common man on the street will be, what prompted the case search? Why is the government going to the local government?
Yeah, because going to the local government, because as it stands now, we have a station where we have community transmission. We have community transmission because if you, for every index case, every contact tracing you do, you have some positive results. So it means we have moved into community transmission state, and the only way by the WHO guidelines to break such community transmission is to go into this aggressive testing. So that if you test community testing, wherever you test and you find somebody positive, you treat the person. Once you treat that person and you do contact tracing in respect of that person, you have break that further transmission with respect to that person or the contacts.
Now that we have community transmission to deal with, let's assess the journey so far in terms of enforcement, especially the use of face masks and the number of persons in our tricycles and the commercial vehicles in Abia State. Can you do that for us?
Yeah, but you see, I must let you know that for starters, one of the basic things required of Abians is discipline. It's discipline. You see, you can't, if I stand on the road and I'm waiting for a tricycle, I should tell myself that if I found two people already seated inside it, I shouldn't enter it. You don't expect a police or security agent to follow every person standing on the road to enter one bus or one tricycle. So you need self-discipline from everybody to help government in this drive. Why do you need to why would you need to go to a place where someone is holding a burial or a wedding reception and you already exceeded the number and it's crowded and you go there and you sit down? So our people really need to be disciplined. They really need to exercise self-caution. You need collective, the fight and the fight against coronavirus is a collective responsibility. It's not just that of government alone. Government is here to roll out the orders, to roll out the policies, to roll out the guidelines, but people must learn how to obey it.
Interesting. Now let's focus Aba being the commercial hub. In fact, in terms of population density, the Aba North and South local government areas of Abia State do have the highest number of population in terms of density. Has there been an improvement in compliance from Aba?
To some extent, there is. I can tell you that. To a great extent, there is.
Oh, that's wonderful. Sir, it means we need to keep obeying those guidelines set up by the Interministerial Committee.
Exactly. If you go to a church, you find the number is already more than what is approved, you go out. You go to a public gathering, you find out the number is exceeding, you leave the place. It's for your own good.
Okay, Barrister, let's turn our attention to the education sector. What is the position of the committee in the argument over school resumption?
We are following federal government directive. As of today, government has not said schools should reopen, but I can tell you that we are already meeting to ensure that we'll look at the possibilities in case government lifts the ban, and then we'll set out our protocols and guidelines to ensure that if our people have to go to write WAEC exams, that they stay safe and they remain safe. So we are considering a lot of factors, and as we put those factors together, at the appointed time, we'll roll them out. But one thing is key: the safety of the children is paramount and important to government.
Okay, you earlier in the week, that was last week, handed the task of enforcing compliance to the Transition Committee chairman. How are they coming through?
They are doing well, but they could do better.
I want you to talk much more on that in specifics now, probably cite examples on some of the local governments.
Yes, I held a meeting with them a few weeks ago, and I told them clearly their enforcement themes should be strengthened, particularly with respect to burials, with respect to weddings, with respect to public gatherings, and emphasis on face masks. And we'll continue to drive that. And go and enforce that more aggressively, particularly the face mask, which is the first level of protection every Abia needs to ward off the infection and transmission of coronavirus here and there. So
okay.
We'll continue to enforce that, yeah.
Okay, that's great. But before I let you go this morning, Barrister, I would like you to talk on the issue of welfare of Abia. And some churches are still complaining that they are yet to get the palliatives, and of course there's some unions too. Will there be another distribution of palliatives?
One is ongoing right now. One began on Friday. I'm sure you saw that in the press release.
Yes.
And we are still on it, and it continues today. So, and again, you must agree with me that while we attend to the churches, we attend to local governments. Those people in those churches are equally members of one local government or the other. So most times you want to get it from here, get it from there, get it from there. But government will continue to do its best at ensuring that we attend to the welfare of our people. Thank you.
All right. Thank you very much, Barrister Chris Ezem, the Secretary to the State Government and also the Chairman of the Interministerial Committee on the Control of COVID-19 in Abia State.
Thank you.
Okay, we take a breather now. When we return, we take your calls on the program, Abia State COVID-19 Update, live on several radio stations in this state. The numbers are 0808 182 6949 or 0811 605 2949. You can also drop messages on 0906 510 8289, both the regular SMS and also WhatsApp messages.
This is Abia COVID-19 Update. Abia COVID-19 Update.
It is still Abia State COVID-19 update, and of course it is time to get your reactions concerning COVID-19, the control and of course the compliance in Abia State. Let's get your reactions this morning. Hello, good morning to you.
Yeah, good morning, Michael.
You're welcome. What's your name?
Yeah, it's Alvan. I'm calling you from then.
Okay, Alvan.
I commend the Abia State government in the way they are handling this global health crisis. Of course, the massive testing they are going to embark on is a good one. Of course, people should make themselves available for the test. But I must tell you, Michael, yes, government has tried to make the rules, but we still need to step up on the enforcement. If you go around, you see people doing different functions, burial, traditional marriage, wedding, without any, adherence to this rule. The level of enforcement should step up. If you go around, you see people moving around, no face mask. So let them not stop at making the laws. Those responsible for this thing. Because if you allow people, it appears the whole thing is over, everywhere has been opened. So what is the essence of moving around to test people if they cannot compel people to obey this directive? That's my own worry. Have a nice day, Michael.
You're welcome. Hello, good morning to you.
Hello, good morning.
You're welcome. What's your name?
Yeah, my name is Comrade Manuel Okawaka, Michael.
You're welcome, comrade. From Abba?
Yeah,
right.
From Abba, Michael.
You're welcome, comrade.
Thank you. I want to add to Abia State government. Like I heard what the Secretary to the State government said. Was that the welfare, their impact, the role they have played in Abba particularly. Michael, I want to tell him that if they are giving him information that so many things are happening here, it's very, very wrong, because people have seen the thing that nothing is happening anymore. You can come here, you're a journalist, you can go to Ariaria, Ayoho, Ehere Market, Ohanko, go and verify the information that I'm giving to you now. Go there and check and know what Secretary to the State government are saying if it's the truth. That is one. Two, Michael, concerning the issue of wedding and the burial, I want to ask if something that I can reach the secretary to the state government, does that the state government law prove that the local government chairman or anybody will collect money for them to approve anything concerning wedding or burial? So if you look at those things, I discovered that so many things are happening. I want them to look inwardly. So many things are happening, the approvement of burial and weddings. Because some people have seen those things as a way of making money. That is the reason our people have not believed there is coronavirus in this place. That's the truth of the matter. Everything is gambling. Everything is, turning it to be a way of settling some individual. That's the way they're saying it. So for me, I want to appeal to the state government. Let them look at those information that I'm giving to them now. Those people that are giving the letter approval of the burial or the wedding.
All right.
Let them come and verify those markets that I told you. Nothing is happening here.
All right, comrade, quickly wrap up your thoughts.
Nothing is happening here. Thank you.
Thank you for your observation and contribution. Hello, good morning to you.
Good morning, Michael.
You're welcome.
That's from Umahia.
Okay.
I'm trying to ask the SAG question whether it is true that anybody that goes for the test that is going on, that he will be given a sort of certificate to show that the person has undergone such a test and that he's free of the.
I will put that question to the appropriate quarters now. But as far as I am concerned, that is not correct. That is not, because I also took the test and I wasn't given any certificate, sir. But I will definitely put your question across.
Like somebody said, the government cannot succeed without the people. And we have seen that in Nigeria, people continue calling government, when the family is the problem. The community is the problem, because they are not cooperating with government. Like I said that time, government has done enough sensitization. It has come to a level now that, Michael, people will see you wearing masks, they will be making a jest of you, laughing at you. So, like I said that time, I think it is when we have an unprecedented level of the disease.
Okay, quickly,
people will be dying
please.
like they are dying now in America. That is when people will know that it is either real or not real. Government has tried. They are doing what they are supposed to do.
Okay, your time is up, actually. Thank
Yes.
you very much. We'll have to let you go because of our time. And on the SMS line, Engineer Undubisi says, let's stay safe. S, survey the area. A, access the risk. F, find a place. E, every time, which means survey the area, access the risk, find a place every time. The use of PPE should be our utmost priority. Okay, thank you very much for being part of the program this morning. Abia State COVID-19 update, and many thanks to the partner radio stations, BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. The program returns tomorrow, but please keep staying safe. It is for your good, of course. Stay safe and take responsibility. My name is Michael Oni.
This is Abia COVID-19 update. Abia COVID-19 update.